characterized spectrum in 2015 and Jefferson. We're committed to these 6 domains, like every other major system in the country. The question is sort of, operationally, how are we going to get there, number one, and then how are we going to prove when we've arrived? Because remember, no outcome, no income. How are we going to prove that our care is in fact effective, safe, patient-centered, timely, equitable? How are we going to demonstrate that to all the people who pay the bills, principally Uncle Sam and all the other insurance companies with whom we work? I think that's a core leadership challenge moving forward. We don't really have, the systems aren't robust enough to really do that today, so we have a lot of work to do together to say and to think about when we're actually crossing that quality chasm as outlined by this book and the 6 domains. So let me see if I could sort of summarize kind of all of part 1 for you in 2 slides. So first of all, I'm going to call this summary the 10 Commandments. And you recognize this fellow, right? So you know how hard it is to find a picture of Moses without Charlton Heston popping up? And also, astute observers, I know you're hungry, but astute observers might also notice something unusual about this picture of Moses. He's got that 3rd tablet. What the heck is that? So did you know there were 15 commandments? Listen, my relatives were there. So that 3rd tablet was so heavy. This is also the origin of the word "oi," because God gave him 3 tablets, incredibly heavy. He's 410 years old. You read the Bible, right? He's walking down Mount Sinai and says, "Oi, this is heavy." Drops that one. We only get 10 commandments. Is that wonderful? I have it on absolute evidence eyewitness account. It doesn't play as well in Grand Rapids as it does in other places of the country, But 6 of you got it, so that's good. Okay, so what are the 10 Commandments? Let's see if we could summarize. I'm not going to give you all 10, but let's pick 1 or 2 that make sense. On your left is what we're currently doing. On your right, to summarize part 1, is where we got to go in order to achieve crossing the quality chasm and in order to work in an environment of no outcome, no income. That's what reform is really all about. It's not about the insurance companies. That's all smokescreen. It's about a fundamental change in what we do together every day. It's about transparency, accountability, asking the patient what's important to them, practicing based on the evidence. Any doctor in this room over 40, it's too late for you and me. Because we didn't grow up in an environment where we learned how to practice this way. So you're going to build a new medical school, there's hope. So let's come back to the 10 Commandments. Let's pick 1 on each of the 2 slides. How about number 2? Professional autonomy drives variability. That's a fancy way of saying, in my experience. When the gray-haired senior clinician makes rounds and says to the trainees, in my experience, or better yet, my favorite, in case after case after case I have seen. Well, in epidemiologic terms, that's an N of 3. But in our hierarchical control system, oh my God, did you hear what Nash said? In case after case, he must be right. So shift over to the right. Care is customized according to patients' needs and values. Good Lord. How are we ever going to do that? I don't know. But let me let you in on a little secret. The author of these 10 Commandments is now the administrator of the Centers for Medicare and Medicaid Services, the one and only, the high priest, Don Berwick. Whoa. So he's got some ideas of how he might measure and pay us to do this. He's only 2 weeks into the job. So let's go to the second set. How about my favorite number 9, cost reduction is sought. So, our elected leaders from President Obama on down, campaigning to pass health reform, every day they said we must reduce health care costs. Knuckleheaded. Watch this. Paying attention? Okay, colleagues, Raise your hand if you think in the United States of America healthcare costs are going to go down in the next 2 years. Okay, wonderful. Not a single hand goes up. So, of course, you're right. The only way to reduce costs is what? Well, we learned from every industry, and Captain Mike alluded to it, of course. Number 9, waste is continuously decreased. Well, what exactly does that mean when you're not building widgets? Well, it means when a patient gets transferred from Temple University Hospital to Jefferson, we don't repeat every test. If they get transferred from the University of Pennsylvania, we repeat them twice. Right? Or standing orders that make no sense. Or pre-op test orders that make less sense. Or using the Cef de jour antibiotic for pre-op prophylaxis because that's what the detail rep told you 2 weeks ago. Everybody in this room knows exactly what I'm talking about. If not, you're not being honest with yourself or with me. So this is a tall order, these 10 commandments. How good a job do you think we're going to be able to do tackling any one of these? Well, let me show you sort of now where the country's going. So first, a little bit of transition. The people who do this sort of work full-time, like me and a host of others, largely inside the Beltway, just let me give you a little bit of insight because you're here in the wonderful Grand Rapids. You're not 90 minutes north of the craziness inside the Potomac River. So there are 3 principal groups. One group that develops measures, another that certifies them, and a third group that implements them, and you recognize these, NCQA, NQF, and so on. The real challenge here, colleagues, is that the folks leading each of these silos really cannot stand each other on a good day. So we have some real emotional issues here as well. Part 2, not only can't the experts really stand each other, and I mean in a visceral sort of way, but for the average well-meaning, well-trained private practice doctor in America, what does all this mean to him or her? Easy. Nothing. Let me put it to you a different way. What incentive does a well-meaning, well-trained private practice doctor anywhere in Grand Rapids, what incentive does she have to even care about these 3 silos and all the measures on October 1st, 2010? And the sorry-ass answer to that question is not a big incentive at this moment. So another challenge about reform, if we're really going to move to no outcome, no income, we've got to make sense out of these 3 silos. We have to make these measures granular and making sense to the people on the front lines like you and me. I'm hearing a little bit of feedback. Is that just me or? Okay, great. First Friday of the month. All right. Feedback is the first Friday of the month. Not sure I get that joke. Tornadoes. Sirens. Tornadoes, sirens. Where are we? The emergency warning system. You're pulling my leg. No? No. Okay. That's wonderful. You know, forget it. I had another story. I'll tell you later. All right, I'll tell it now since you're laughing at me. Okay. So we're, Jerry Ford, right? We're in Jerry Ford territory. Wonderful. Well, in 1995, I had dinner with President and Mrs. Ford. True story. You can't make this up. Has nothing to do with quality. We're taking a 3-minute time out here. So I'm at the Thunderbird Country Club in Palm Springs, California, where the President and Mrs. Ford were members. I had given an endowed speech at the Eisenhower Medical Center, where she was a major donor and on their board. And when you get to give this speech, your reward is having dinner with the President and the former First Lady. So you got to picture this. We're at this fancy country club, 1995. President Ford's got all his marbles. It was actually a wonderful dinner conversation. And at the table is Bob Hope and his wife, and Gene Autry and his wife, President Ford, Betty, and yours truly. So that's not your everyday dinner. You got to remember who Gene Autry is. I needed my father to explain, Okay. So we're having dinner, and I'm sitting between the President and Mrs. Ford. And the president is a lefty, you'll remember, right? And his left arm is in a sling because he had yet another golf-related injury. And, he was a little, a very athletic guy, but a little bit on the klutzy side. So anyway, to cut to the punchline, so we're having a nice conversation. We had the salad. Then I see they're serving filet mignon for the main dish. And I'm between Mrs. Ford's to my right, the president's to my left. And I said to the president, because his arm's in a sling, I said, Mr. President, would you like me to cut your steak for you? And he said, oh, well, that would be very nice. So